When you have conversations with any executive about this idea and the concept of social risks and social insights, one of the things that I found to be particularly helpful is to personalize the situation for a second. Because most executives, as they've gotten on in their career, right, they're in their 40s, their 50s, their 60s, 70s, maybe as part of that. Either they themselves have gone through healthcare challenges, or like many of us in our 40s and 50s, right, we're managing both our kids and our parents on the other side. And having a real conversation about the blind spots. What did that provider, that health plan not know about your mom or dad as you were trying to help navigate their care, as an example? Did they know that they weren't able to drive anymore? Did they know that they were having trouble finding healthy food options for them? I think there's an interesting opportunity to create some vulnerability and some perspective as part of that conversation. And then, and the other way is to talk about the populations that they all care about. Sort of this, again, the simple idea of talking about maybe a diabetic population and the fact that some are going to be doing really well, but that others are struggling, right, with food insecurity or transportation or financial challenges as part of that. And the doctors that are underneath them, if they're the executive or the chief medical, chief executive, their physician, their care teams are treating them all the same way. They're using a best practice care algorithm, expecting the same results, but that the people that they're supporting aren't the same. They have different barriers and challenges. And those two ways, both to look at it personally and look at the population, I think really resonate with people.